But let's now bring in the Chief of Borno Field Office of UNICEF Nigeria, who joins us live from Maiduguri, Phuong Nguyen. Thank you for joining us on TVC News at 7. Interestingly, it's a year now since Nigeria was declared wild polio free, officially certified. And now Africa itself has been declared polio free. Just how significant is this proclamation?
Yes, thank you very much. And you're right, this day, 1 year ago, the African Regional Certification Commission for Polio Eradication declared Nigeria free of indigenous wild polio virus. And in fact, the last case that was detected was in 2016. Now, in order to have this certificate, it is required to have 3 years of consecutively good surveillance mechanism without wild polio virus detected. And so this is the requirement that has been made, and Nigeria is able to get this 3 years without that virus. Currently, the circulating vaccine-derived polio virus we are seeing, it is not a reemergence of the polio virus, but rather it is an indication that routine immunization is weak, and by an extension of that, the health system is weak. Now, the good news is that the same strategy used in eradicating wild polio virus is also employed in stopping its transmission. So UNICEF and our partner have been working very, very closely to eradicate wild polio in Nigeria. And some of the challenges we're facing had been the social norms and the belief system, as well as socioeconomic issues. There were cultural practices that stopped caregivers from accepting or completing routine immunization or polio vaccination for their children. Other concerns are that polio vaccines are not safe, and that the vaccines are somehow not useful or beneficial to the children. So we're fighting that by working very closely with the media, but also with traditional and religious leaders to make sure that we build the confidence and the trust in that the vaccine does work. Through social media, through campaigns on TV, radio, and so forth, and also religious gathering, we pass on this information. And we also have the great support of the media, who really contributed greatly in changing the perspectives of the caregivers.
All right,
also,
we know
finally,
that
the evidence. Yes.
And we know that sustainability is key because we cannot afford to go back to those dark years. Now, considering the state of insecurity and other social issues that are still very prevalent in our society, how sustainable really do you think this achievement could be?
Yes, I think UNICEF and our partners have been working very closely in building a strong network of health personnel through our polio campaigns, house to house, door to door. We engage with religious and cultural and community leaders within the communities themselves. So this is where the sustainability of our work comes in. We're not only doing it during campaigns, but as part of routine immunization as well. So it is, in fact, very important that we have this buy-in, the buy-in of the religious and community leaders. It is very, very important. And we're employing the same through our polio eradication with the current COVID-19 pandemic, really using the media, using the cultural and religious leaders, using community members themselves, and really trying to get people to understand that polio eradication is important, vaccines are important, and this is the same exact strategies that we are employing now for the COVID-19 pandemic.
Indeed, I was going to talk about the fact that this also has a spiral to COVID-19 and other health issues we might actually be tackling as a nation. Phuong Nguyen, Chief of Maiduguri Field Office, UNICEF Nigeria, thank you very much for joining us on TVC News at 7.
Thank you very much.